Thank you so much. I would like to, first of all, thank BW Healthcare for the business world to organize this very important healthcare conclave. You know, as a practicing doctor and also the director of a hospital group, you know, there are multiple challenges we all face in every day. And I think the COVID pandemic really brought this out in the forefront. You know, against the WHO recommendation of 2.9 beds per 1,000 people, India is currently at 1.84 beds per 1,000. And the private sector commands 90% of these hospital beds. 80% of doctors and 60% of inpatient beds are all commanded by the hospitals. The hospital industries in India is currently accounting for 80% of the total healthcare market. And it is currently growing. It's growing by leaps and bounds. And in fact, it is expected to reach 132 billion by 2023. But that being said, the COVID pandemic really brought in the forefront these, what you call, lacunae in healthcare. You know, we all have stories of people who were needing beds. We all have stories of people who were running around for oxygen. And the question is that post-pandemic, where are we headed? How are we headed? Where are we going to go there? And for that, we have an esteemed panel of experts with us who are going to discuss, you know, how each of them is looking forward for the next 20 years. So let me begin with Dr. Gupta. Dr. Gupta, you are here. You are a doctor. You are the managing director of Felix Hospital. You know, I'm sure you must have gotten stories, right? That you know, I need a bed. I need this. I need oxygen. You know, we all had those changes, all those challenges. So in terms of infra, you know, how are you seeing this going forward?
Thank you so much for BW, and I will really congratulate them to organize this important session. I think this can be one of the eye-opener for our government and stakeholders. We know that we are having around 1.35 billion of population. Around 70% of this population is residing in rural areas. And as you talked about, around 70 to 80% of healthcare infra is confined to tier 1 and tier 2 cities only. 70% of the population is struggling with the poorest of poorest primary healthcare services that are only provided by the government. Even no private player is going to these rural areas or to catering these population. If we talk about hospital spend of our GDP on hospital healthcare infra, we are investing only 1.2% of our GDP. That was around 1% for last 70 years. Last year, because of COVID and because of good vision of government, they invest around 1.8%. And their vision is to improve this 2.5% by coming 2025. If we compare this GDP spend to the developed countries, US spends around 70%, Italy spends around 15%. Most of the developed countries, they spend more than 10%. Even the developing countries, if we talk about the BRICS countries, excluding India, China, other Brazil, they all spend more than 5% of the GDP. Even WHO says that for a better healthcare services, you should at least invest 5%. So we are lagging behind from all developing and developed countries. Our if we talk about the healthcare infra, that is confined around, you already talked about it, around 70% of healthcare services that include doctors, nurses, OPD, indoor surgery, they are all provided by the private hospital players. But private hospital players do not have any support from government in form of private-public partnership, that all the hospital across the India who want to set up a hospital, it requires high amount of capex and great amount of opex also. There is no subsidies on land allotment. We get it on the commercial rate. There is no funding support, financing support. Even the accreditations, there is a very difficult to get accreditations also. There are around 26 or 27 licenses we have to get from the government and local authorities to start hospital. and there is no single window for that. Like first generation entrepreneur or those who are not having knowledge of this licensing process, they cannot start a hospital. If they start, it will be closed. So I think there are lots of challenges starting from the developing good hospital setup in tier 2 and tier 3 cities, to challenge developing R&D setups, challenge developing highly nursing colleges and skill development colleges and institutes, and challenge for training our doctors, because we know that the government is now very prompt and very aggressive setting up the medical colleges across India in district hospital. So there is a I think doubt regarding the quality of doctors will be coming out from these district hospital. Means we have to definitely provide quality doctors for which we are famous in the world. So I think there are lots of challenge in infra, and that this is the one thing we require to support our healthcare infra. That is only political will. If we have political will, definitely allocation will be high, and if allocation of GDP is high, definitely we can have different sets of things that will support healthcare infra.
That's some very good input, Dr. Gupta. One of the things you brought about was the infrastructure challenges, right? The land is not getting at a proper rate. There are a lot of liaising problems. And we have with us over here, who's joined virtually, Dr. Vivek Desai. Dr. Vivek Desai is the founder and managing director of HOSMAC. Dr. Desai, one of your expertise is building hospitals, getting them, starting greenfield projects, getting them up to getting started. When I look at the metro, for example, I live in Delhi, and, I've talked to colleagues from all metro cities, Delhi, Bombay, Bangalore, Calcutta, Chennai, and they all say that there are a lot of hospitals. Over the last 20 years, we've seen a flurry of hospitals open. They may be of varying sizes, right, from 5 beds to 2,000 beds. But, so it almost sounds like the metros are almost saturated, right? There are so many hospitals, so many healthcare providers. What is your opinion? I mean, as an expert on the field of infra, which is your expertise, what is your opinion? How do you see this?
Right. Thanks, Amir, and thanks, BW, for organizing this. I think, as rightly said, the earlier speaker mentioned about it, that India and Bharat are two different things, and they will have two different sets of, solutions that one would need. Now, what comes to mind post this pandemic is we were really, hard pressed to understand how do you reach healthcare in this tier. I'm not saying tier 2. Tier 2 probably we still are better off than, the tier 3 and the rural areas. And where that 50-60% population resides, there is hardly any healthcare. So after that, there have been a lot of thoughts, which have been given. Government on its part initially had taken its stand that they probably will like to take a payer positioning, and which, with that in mind, they launched Ayushman Bharat, which has done fairly well. There's no, if your inputs are correct, money gets in the private players' hands pretty much quickly. But that penetration again got limited only to this tier 2, level of cities, and maybe the smaller setups. The larger private hospitals are not willing to get into it. But now the government, having seen that in COVID, you need, even the provider setup. So that is how they have come up and started to unleash, medical college projects throughout the country. If you go to states like UP, which had dearth of, this kind of a concept. So they have set up, I think, more than 21 medical colleges in the last 4 years. So they have seized on the fact that we need talent, and we need talent not only in MBBS kind of doctors, but we would also need talent, when we scale ourselves up. We need MD, we need MS, we need DM, we need MCH. And they are doing their bit, through PPP formats or, upgrading district hospitals, as Dr. mentioned just now. So they are looking at it, in a fairly serious way, and they are doing it. In fact, we are doing a School of Medical Research and Technology on campus of IIT Kanpur. The idea is to bring in, the jive in medicine and engineering and try and get up products which are Indianized in nature. COVID also taught us that heavy reliance on imports is not a good thing, for India in the long run. So that is something that probably will help us scale up. This will be only a super specialty DM MCH kind of a training institute. Another one we did was for Indian Institute of Science in Bangalore, again a PMO-backed project where they are going to do a postgraduate institution wherein a doctor who rolls in will have to mandatorily do a PhD. The idea is to convert doctors into scientists. So one thing is to create infrastructure which is also research oriented, because we need that in the longer run, that we are self-sufficient, in our own thing and not reliant. Most of you are hospital owners. That even today 80% to 85% of the equipment that you put in your hospitals is imported. It's all not made in India. So that needs to change dramatically. Some other things that the government probably is doing its bit is in terms of skilling, because the moment you open hospitals and healthcare beyond this tier 2 markets, you will need skilled human resource. I was in JNK, a month ago. I have been traveling to the Northeast quite a bit. We are doing projects. We are seeing traction as a consulting company. A lot of doctor entrepreneurs are wanting to now come up with hospital setups in the smaller towns, and they probably will do well because they are known in their geography, so their patients believe in them. You just need to now give them ample of encouragement to do that. And some things that come to my mind is, government probably will have to think of healthcare as an infrastructure. We've not yet recognized as that. So our interest rates when we borrow money in the market, are as comparable to others whose EBITDAs and whose, PAT returns, post-tax returns are much higher, than what hospitals do. So we would have liked to have softer tax regime. We would want, longer tenure, loans, to be given, because no hospital probably breaks even in the first 3 to 4 years. The gestation period needs to be tided over. So working capital requirements are pretty much steep. So those kind of things need to be there. Some tax benefits, if we could look at, maybe probably that would help us. Especially if I am trying to do something in terms of, if you would have heard this budget, greener economy, so and hospitals are guzzlers of energy. So if I'm doing something, 24 hours, 365 days, 40% of the hospital needs air conditioning. It's a pretty expensive affair to do. So if I'm becoming energy efficient, would you be willing to give me some property tax, rebate or something in terms of a subsidy in electric energy pricing? That would help, because energy itself is about 4 to 5%, of the total income of a hospital gets into your energy bills alone. So those kind of things the government can do. But yes, going down in that area of tier 3 and semi-urban or rural, we probably would be, beginning with secondary care, in going in there, because tertiary and quaternary probably will still have to flow down to the second, the tier 2 towns. So you will need to have kind of a referral chain, where the government can also come in and the private sector can also probably not invest into big time infra. But if the government wants their help in certain things, they can hive off, say critical care, cardiology, oncology, these dialysis, super specialty kind of thing to players who would want to do that. So that's what I think the way healthcare infrastructure should move in this country.
No, that's some very good input. Setting up a hospital is definitely not easy, and the infrastructure requirements, the regulatory requirements, the financial requirements are just tremendous. But that's how. But it seems that the world is changing, right? I mean, a lot of us are going tech heavy. I remember seeing this post on LinkedIn. It said, who was responsible for the tech revolution in your company? And there were 4 choices: the CEO, the CFO, the CTO, and COVID. And everybody had chosen COVID. So, COVID has really changed everyone and changed healthcare. And I'm going to bring the next question on to Dr. Preetpal. And Dr. Preet, you've started Glamio. You're using tech to a very large extent. How do you see tech coming in and taking some of the stress off from infra?
Hi. So first of all, thank you, Business World. Right. So I'll give you a brief intro about Glamio. So at Glamio, we are reimagining the elective surgery space, and we are utilizing the underutilized or spare capacity which is already available in the system. Right. So just for starters, there are 44,000 hospitals in the country. Roughly 50% to 40 to 50% is the capacity utilization on an average in these hospitals. So this is to say that instead of counting them as 44,000, you can say that they're roughly 22,000 only, right? So 22,000 of the hospitals are not being utilized in the private space, right? Now, COVID has accelerated certain sort of innovations in the healthcare delivery design. Right. So most of the healthcare delivery design earlier was focused on generating the patient from a nearby catchment area and relying on sort of servicing the demand in the nearby 3 to 5 kilometer radius, right? Because healthcare is local, right? For most of the cases, unless the patient is driven by a star personality doctor, let's say if he wants to sort of get operated by Dr. Naresh Trehan, he would, let's say, travel 100 kilometers, right? But otherwise, he would just want to be operated in 5 to 7 kilometer radius, right? Now, that was the bane which was existent in the system for very long, right? That we have lesser capacity is a known fact, and that is not going to change in next 20, 30 years by a magic wand, right? That will gradually sort of improve. But what can we do to improve the utilization of the current capacity? Now, that is where a startup like Glamio Health sort of comes in, right? So what we do is we essentially help in utilizing the existing or the better utilization of the existing infrastructure. Now, that is very important, more so after COVID accentuated the inefficiencies and insufficiencies of the healthcare infrastructure.
So I think that's great, right? So you're saying that there are hospitals which are currently understaffed, underutilized, capacity utilization is not optimal, and that's where you come in. And but at one point we are saying, at one place we are saying that there is not enough beds, the infrastructure is becoming challenging. On the other side, we are saying, the capacity utilization is not good enough. So, Dr. Mishra, you are the CEO of AHO Healthcare. You are trying to bridge that gap of capacity utilization in existing hospitals, especially in tier 2 cities, tier 3 cities, where the hospitals are not big brand names. They are smaller hospitals. It's kind of what you call the more unorganized sector. So how do you see these smaller players in tier 2, tier 3 cities coming up and contributing maybe in a more efficient way, if I was to say that, in the current infra requirements?
First of all, thank you, Business World, for giving this opportunity. Very pertinent question. Basically, India, when we talk about healthcare, it divided into India and Bharat, as mentioned by some of earlier panelists, wherein all bigger cities are having all the tertiary care and all the good facilities. But tier 2, tier 3 cities, all these hospitals are run by single doctor or family member, husband, wife, duo, and they are with their best capability. They are trying to provide healthcare. In fact, they are providing 70% of healthcare delivery in terms of numbers. I would say 70% of healthcare delivery is being delivered by all these small and medium hospitals, while AHO's focus is hospital 10 to 100 bed capacity. So all these hospitals are basically serving to real India, where Bharat per se. These people are having obviously the cost efficiency, cost they want to have to deliver in certain cost limit as well. And the capacity utilization is again a big challenge for these doctors. So we at AHO had identified these problems and try to support these hospitals by giving them a branding, giving them employee training, because employee is something, doctor which interact with the patient, IPD patient especially 1 or 2 times in a day, but their staff is mostly underqualified or unqualified staff, the slow gradually they have been trained. These hospitals are not using infrastructure, in fact, in our survey, we found 80% of these hospitals are not even using any EMR software, electronic medical record software. So there is no real data about the patient is available. They are not using any training module for staff. So, and 50% of these small and medium hospitals are not impaneled with any of the insurance healthcare TPA chain. So anybody who's having insurance card is not able to get cashless insurance, cashless benefit done also. So there is a huge gap while we talk sitting in Delhi and Mumbai or metro city and a smaller town. There is a huge gap in the expectation and huge gap, difference in the delivery mechanism as well. So we at AHO are trying to bridge this gap by providing support to these doctors and ultimately improving their this capacity utilization with the help of technology and with the help of outside support so that they can deliver better.
No, that's great, right? So all these things that you're doing in the tier 2, tier 3 cities, this is going to try and get the confidence of the local residents over there in that particular hospital. So that'll improve healthcare in that area in general. We've talked a lot about Dr. Gupta, Dr. Desai, everybody's talked a lot about infra and about how difficult it is to run a hospital and, the cash requirements, the doctor requirements, all these different challenges. Dr. Gupta, you run a hospital. You're also a clinician. What is your wish list from the government? And I understand that, we all talk about GDP, right? You talk about, India is 1.5, 1.6%. We definitely want it to be more, but the speaker before said, in the session before, they said, roti, kapda, makan, gaadi, or uske baad health. So, the health is coming there. The cars are definitely getting more. Health is now becoming a priority. The National Health Mission, the Ayushman Bharat, they're all steps in the right direction. But irrespective of that, what do you want? Like, how can we improve the healthcare infrastructure of this country? And we also, as healthcare infrastructure improves in the tier 2 cities, tier 3 cities, one thought which often comes to mind is that I am a practicing clinician. I'm also the management of a hospital. When a lot of my patients come from tier 2 cities, right? People are very easily come from Gorakhpur, which is, so far 12 hours away. People are coming from Agra for an appointment. People are coming from all these faraway places for appointments and for treatments. If there are good healthcare infrastructure available in those cities, will the local medical tourism, the medical tourism, we often talk about international people coming, but what about the local medical tourism we have? People coming from tier 2 cities to metro cities for healthcare. Is that going to change?
Definitely it will change. Like, first, we should know what is the statistics. 62% of our population is investing on out of pocket. I mean, they have to bear the treatment costs by taking loans, by selling out their properties, from different media. It means the insurance penetration is quite less. We have launched Ayushman Bharat. We know our vision should be quality healthcare, not healthcare. Quality healthcare. The rates of the Ayushman Bharat or CGHS rate are so much low that any hospital in India that cannot provide a quality healthcare subsidy at these rates. Even CGHS rate, they had not been revised for last 7-8 years. Even Ayushman Bharat rates are so low that even you cannot have operating or variable costs on these rates. Quality healthcare service cannot be provided on that. So I think government should focus on increasing the insurance penetration. We know that all the developed countries, they are providing free of cost healthcare services, being NHS or being US, any developed country. In India, we all know that 62% are they are investing out of pocket from their work, like taking loans and other things. It means insurance penetration should be increased, like Ayushman should have. Currently they are having around 40 crore population they are covering. The rates should be revised. They should be at least affordable. I think they should compare from the government hospitals. Even government hospitals are quite expensive than us. If you audit these hospitals based in Delhi or any tier 2 cities or district hospital, even per bed expense is quite high as compared to private sector. I think they should match at least the government rates so that we can survive. Definitely. Next, you are expecting that we should all in healthcare service sector, we should be social service sector. But why are you providing landed commercial rate? Why are not funding us? Why are you supporting in financing? Rates of interest is same as commercial rate. The duration of, as discussed by like housemake director, the rates are similar. The incubation period, we know that it is quite high, but they don't consider in our infra. They give loan for 10 years or 7 years maximum. It is not possible to make break even. There is no option for working capital. I think there are lots of challenge in right now. If we talk about the manpower, training and development is most important. We don't have quality of nurses in tier 2 and tier 3 cities. We don't have technicians. There are so many people, those who are treating like patients, they are not trained, they are not qualified, they are just having experience in tier 2 and tier 3 cities. I think government should focus on like skill development and training through different media. Like I think that digital is one of the most important fact. Right? If we want to go to tier 3 cities and rural areas, I think digital is now disrupting the healthcare system, and we should adopt. I think there should be digital health clinic across the India, and government is definitely doing great on the digital health platform. They have already launched in last budget, and they have reinforced same thing in this budget also. So I think these are all parameters government should focus on, so that we can improve our infra and we can be at least comparable with the big countries.
No, that's some very good input, right? That you have doctors, but you don't have quality doctors, right? You have people who are getting out, but they may or may not be up to the level to treat patients independently, and that can lead to problems. Now, Dr. Desai, you mentioned that you are doing a lot of work with IISc, you're doing some work with IIT Kanpur to try, and where they are building, these hospitals, which are super specialty hospitals, along with education, with super specialization programs. I know you're also doing some work with the government. So how do you foresee this coming out? How do you see capacity, healthcare capacity improving, not just in terms of infra, but also in terms of manpower?
Right. Yeah. No. So the government, like I said, knows this problem. It's, they are aware of this, and they are doing their bit. They have already increased, the ratio of students to professors for super specialties and postgraduates. They have done that. They have reduced the infrastructure requirement for medical colleges, making it slightly easier. 25 acres se kam karke, 10 acres tak bhi they have, tried to do that. They are further looking how private sector hospitals can also be provided permissions, to take postgraduate students. So all that they are probably doing. The other thing that, comes to mind is we're doing some work for GVK in Hyderabad. GVK runs an emergency medical number, if you have heard of that, 108. And they run it for 18 states. Now, I was quite impressed, and intrigued by the fact that they also do training for emergency medicine, which is one of the things. And they are using simulation techniques, so that is something makes it probably easier to reach out to more people. The doctor from AHO mentioned that one of the things he's doing is training of the paramedical human resource. Now, if you can use techniques like those, I think it will be, you need those numbers in large numbers. You need to double the number of doctors. You need to, triple the number of nurses, probably paramedics. So we will not even touch that. So we need to do that. So simulation can be one thing. Government is looking at that. National Digital Health Mission, is the other thing which probably you will see very soon. Ayushman Bharat Digital Health, there will be a card, and it will allow you to pan across the country, which is another important thing that we need. A laborer who works in Bihar comes to Maharashtra, migrates to Gujarat. He needs to have a continuum of healthcare. So they have seized on that fact. They have invested into it. And I think very soon, probably within this year or the next financial year, they will launch that out. There will be a registry of, doctors and providers. So that will again help us. Everyone will get tagged, and CoWIN app actually taught us that when you try to adopt technology, you can actually do it in a much better way. We've traveled across Canada, US, Germany, and we saw that it was not as good as what we get in India, in terms of getting the quickness with which we are able to do RT-PCR tests, getting results, getting vaccinations done. So when you look at it, they have done their bit, and probably they are willing to look at, more and more, like doctor said. I just read, that very soon probably they would be upgrading the rates of Ayushman Bharat, as he mentioned, because middle income group, also been brought into that.
Oh, that's some good insight, so hopefully with this, we are running short on time. So we'll take some quick remarks from Dr. Preet. Dr. Preet, technology in the next, in healthcare in the next 5 years, 10 years, is it going to be where the Zomato is bigger than the actual restaurant?
I think that's a good question, right? So clearly there is a need for reimagining the delivery design, right? Obviously, with the country population at 1.5 billion, we can't create enough hospitals, right? That's just not possible. We have to utilize the existing sort of resources to the best possible option, right? So technology is going to be a major driver, and technology has already sort of started reimagining the issues. I'll take one simple use case, right? So COVID sort of exposed our insufficiencies in terms of the number of units that we have for isolating patients, right? So if we can sort of improve technology and create hospital designs in a manner which gives us a triaging opportunity in the beginning, that will save us a lot of sort of hassles later, right? That's a learning from COVID.
Yeah, I think that's great. We all got a lot of calls where we had to triage, and I'm sure you had to put your doctor cap back on in the COVID times. Yeah. Dr. Mishra, last closing remarks from you. Tier 2, Tier 3 cities are coming up. Infrastructure is going up. How much time do you think before the last mile, because you are there, you are helping these hospitals, before the last person says, you know what, I'm having chest pain. I'm biased because I'm a cardiologist. I'm having chest pain. I want to get an ECG done. I should not have to travel, 45 minutes for that. How much time do you think we are before we reach that stage?
We are catching up very fast thanks to COVID, because COVID has taught us how to use technology effectively. We have seen COVID, as rightly mentioned, COVID, everybody was given this vaccine and immediately certificate and everything was taken care of. So technology is going to play a vital role, and we are catching up very fast. I believe next 4-5 years will be very crucial. And next 4-5 years, Tier 2, already the online consulting and prescription already started happening over there, even in Tier 2, Tier 3 towns. Even patients are calling from their village and doctor, I have this problem and medicine prescribed kar dijiye, and then they are doing it. So things are catching up very fast thanks to COVID, and we are learning our lessons. I believe few years down the line, we will be quite better.
That's great. Yeah. So that's a very optimistic outlook all of us have towards the improvement of healthcare. I'm sorry the time is up, but I think this was an excellent panel discussion. I would like to thank all of you for joining us, our delegates who've joined us virtually. This was excellent, and we hope that the healthcare infrastructure gets improved before the next pandemic. Thank you so much.
Thank you.